thank you all, and thank you to Luke for having me join. As Luke said, one of my roles here today is being the program coordinator for the Surgeon Well-Being Program. I split that time as well as providing support to 3 additional committees within ACS. So I also work alongside the Women in Surgery Committee, the Committee on Diversity Issues and Intimate Partner Violence Task Force. But today we're going to briefly talk about the Surgeon Well-Being Program and kind of where it's at. So in mid-2019, a group came together to form the Surgeon Well-Being Work Group to explore what could be feasible for ACS to provide to its members, focused on well-being. And as Luke mentioned, I came on staff in March of 2020 to bring additional support to start building out the program. On your screen here, you see our vision and our mission. And this came out of doing kind of a delve into what is existing in that space right now around surgeon well-being. I think oftentimes we hear the word burnout, and we're really trying to, within the ACS, sort of look at it. Burnout is one indicator of well-being. And so we're really trying to look at well-being as sort of this holistic, comprehensive, person and a human being that has multiple dimensions to it. And so that's really what drives our need to look at the individual, but also look at the systems that influence well-being and recognize that burnout is a symptom that impacts your well-being. So within the program, we've developed 4 goals. We'll go through them on the screen fairly quickly. All of this information is on our the FACS website underneath member services and underneath surgeon well-being. And so one of the really important things as we did our research was sort of in our environmental scan and literature reviews was really looking at the stigma around burnout, around well-being, and where in that space can we provide education, resources, and tools. So that's always kind of a guiding forefront for us, is how are we opening up that conversation, starting to create those safer places and that vulnerability for surgeons, other healthcare professionals to be able to say like, gosh, I'm not doing well, I need some help. The other thing that our program aims to really look at and do as well is looking at the adverse effects of what happens when we have decreased surgeon well-being, and looking at the signs and the symptoms that associate with burnout, as well as with sort of the environment and the culture. Again, sort of those systems within which surgeons work. How does that influence it? If you get up and you're like, gosh, I'm really excited to go do surgery, but I really don't want to be in my hospital environment today. Like, how does that impact that person? And then, we always talk about resilience and grit among surgeons. And resilience is where you're able to face that adversity when it comes at hand. And we recognize that there is a certain level at which you have you've skilled an individual to be resilient in the most adverse situations. And at that point, that's where the systems level work has to come in. But for those that can still build their skills and resilience, we still want to be able to tap into that with our programs and our initiatives that we offer. And then we recognize how important work-life integration is for the surgeon. And we chose the word integration instead of balance. We like to view choosing surgery, it is a career profession. It's, kind of that vocation, that calling. And you liken it to, as much as you want to, when you leave the physical space of the hospital or another place of work, that still carries with you. And so how do you integrate your life to have an integration of it, to have optimal well-being, but then also how do social support systems support that? And then our last goal that kind of guides all of the work of our program is really around advocacy, recognizing that there are different systems and policies and procedures that, might not have a surgeon's well-being at the heart of it, like electronic health records, or how are PHP programs designed? Are they encouraging surgeons? Are they easy to use? And so one of our goals is to really, work together with other institutions and organizations to really figure out where can we lend that voice, where can we be supportive to help really make those systemic cultural practice of change that need to happen. So that's a lot thrown at you. So we'll take a little breather. We'll take a moment to look at our strategy approach that we have up here on the screen. And our strategy needs to be both short-term and long term. And it became even shorter term, especially last year as the COVID-19 pandemic, started. And then now as we're, a little more than a year into it, how do you help move into that, space a little bit more now? And so we've developed our strategy into what we like to call our short term is sort of our resource initiatives, sort of those real kind of low hanging fruit that, we can develop internally within ACS. It doesn't take a lot of levers to make something move, such as a systemic initiative like partnerships and coalitions, doing some research, working to create, we envision, can we create a well-being guide or well-being organization guide that can be implemented in surgical departments, hospitals, whatnot, like what is still needed within that space, because there's already a lot of great stuff out there. And then working on some ACS statements. Our work group is currently doing some research around the PHP programs, as well as having ACS release a statement on well-being and what that means. And we're also starting to dip our toes into looking at how could we create a peer support training. So for surgeon leaders at their hospital, if they would like to develop a peer support program there, or even something, at the chapter level, what is feasible? We've had like 2 discussions with some people who have a long history of developing these programs. So we are very fresh into exploring peer support training, but where do those opportunities really lie? And I think in our whole intention of our Surgeon Well-Being Program is really to be very intentional about what we do and how can we be most responsive to the needs of surgeon well-being, while also really working to change, to have an impact on the systems. I think in a lot of the recent, articles and news op-eds and stuff, surgeons they're tired of being told just do some more yoga, just go for a walk, that sort of stuff. So we recognize there is that place for that, and there is that space, but then also where do we need to really change that system? And so next on your screen this is our small but mighty surgeon well-being work group with our co-chairs and our members. And then the program is staffed by myself and Kathleen McCann, who she manages a lot of other member service initiatives and surgeon well-being with me. So we split our time with this program. So that is kind of a real quick overview of the Surgeon Well-Being Program. It's very new. I will plug that on June 9th, we are having our part 2 in a webinar series on microaggressions and surgeon well-being. We held part 1 in April. And that the part 1 is available to view on our website, but then on June 9th at 9:30 Central, we will have part 2 of that discussion. And then coming up, we are working on some webinar series for our younger surgeons who maybe have just entered into the workforce. We've been talking with them about what impacts their well-being. And a lot of it's kind of how do you make that leap from resident to you're now an attending surgeon? And how do the pressures and all of that affect your well-being? And what are some more of those little tips and tricks that senior surgeons could share, even mid-career surgeons could share around managing your workload, all of that. So we're really excited. It's brand new of what we're really putting out there. But if there's anything at a chapter level that you think, gosh, this would be great if ACS had something that our chapter could tap for this, we are very open to collecting all of those ideas and really seeing how we can work and move and collaborate in this space.